Hi everybody, this is Dr. Mike T at Harley Street Skin Clinic. Today I want to talk about skin pigmentation, or more precisely, skin hyperpigmentation. So there are different types of skin pigmentation and they're all due to an overproduction of melanin in the skin. Melanin is the chemical product that gives skin its brown colour, either naturally or with sun exposure, and causes different types of pigmentation problems. So first of all, what are the common types of pigmentation? Well, the main two are related to ultraviolet damage through sun exposure or sunbeds, and the second one is hormonal pigmentation. Everybody should wear SPF 30 to 50 on a daily basis, even if it's not a sunny day and even during the winter months, because ultraviolet rays still can affect you, they can still damage the skin, and they can still cause pigmentation. The older you get, the more likely you are to be damaged, and the more pronounced the damage is. It can appear as brown patches in the skin, and these are called solar lentigines. They're just brown spots, and everybody has them, usually on their face, their forehead, and their hands, their chest. But the good news is we can treat them. So there are various ways these can be treated. They can be treated with various chemical products that we sell in the clinic, and some of which are actually sold over the counter in high street outlets such as Boots, John Lewis, etc. The important components to help treat these are vitamin C and retinoids. In the clinic, we have product ranges specifically formulated to help even out pigmentation and skin tone. And I will talk about these further in a minute or two. So the second type of pigmentation is called melasma. It's usually hormonal. It can be caused by pregnancy, and it can certainly be exacerbated by sun exposure. It's more common in higher skin types. So there are 6 types of skin. Type 1 is very pale skin with blonde hair. Type 2 is sort of medium white skin with dark hair. I'm a skin type 2. Type 3 is Mediterranean, such as Spanish skin. Type 4 is Asian. Type 5 is black skin, and type 6 is very black skin. So types 4, 5 and 6 are at greater risk of skin pigmentation. But again, it can all be dealt with. So when we look at products, there are various product ranges that can help. We use a product range called the iDerm products, which are very effective. There are 6 products, 5 are applied in the morning and 5 are applied at night. They contain vitamin C, retinoids, and also a mild skin bleaching agent called hydroquinone. At the end of that, if the pigmentation has not been evened out as much as we want, then we can go on to a medical peel. There are various medical peels on the market, and some are specifically designed to even out skin tone. So what happens is we prepare the skin, we cleanse it, and then we apply the peel in layers, 3 or 4 coatings. The patient then goes home with the peel on their face, and after 4 hours, they then use the post-peel pack that we give them over the next week, and that really helps even out the skin tone. The more peels you have, the more even the skin tone will be. It's a quick, easy treatment. It's not painful, and it really, really works well. Now that can be used on sun damage or hormonal pigmentation, and it's very effective. For sun damage specifically, one of the best treatments is IPL. That's a form of laser treatment. IPL stands for intense pulse light. We have a very good intense pulse light machine in the clinic, and it targets the dark spots and patches of the skin. It's not a painful procedure. It's a bit like being flicked with an elastic band. And what happens is after the treatment, the patches go a little bit darker, and then they gradually peel off, and then they leave it completely clear. It can be used on the face, neck, chest, hands, pretty much anywhere, and it is almost guaranteed to get rid of all sun damage, all dark spots, and leave your skin blemish free. Another form of pigmentation that we frequently encounter is called post-traumatic, post-inflammatory hyperpigmentation. So if we do a mole removal, then it creates inflammation. Now in a white skin, the inflammation is red and generally settles pretty well. But in a dark or black skin, then the pigmentation is a very dark brown, and it can last for absolute months. Now, when we do mole removal in dark or black skin, we actually pre-treat with a special cream that we have that reduces post-inflammatory hyperpigmentation post-operatively, and it works really well. Patients put it on daily for about 3.5 weeks, and then we remove the moles. You then just get a little bit of pigmentation afterwards, which settles. Without using this special cream, the pigmentation is almost black and scars for months. But as I say, fortunately, all this can be avoided. We can use the cream on difficult areas of hyperpigmentation and also in post-infective inflammatory hyperpigmentation. So for people who have acne and get inflamed or infected spots, it often leaves dark brown pigmentation. And by daily application of a special cream, that can significantly reduce the hyperpigmentation. Generally speaking, the most important thing, where possible, is to prevent pigment changes in the first place. And I've already mentioned that everybody should wear an SPF between 30 and 50 on a daily basis, even if it's not a sunny day. So even on cloudy days, winter days, you should always wear a good SPF. On sunny days, the SPF should actually be replaced up to every 2 hours. It's always sensible to wear a hat, particularly if you're a man of a certain age and your hair is thinning on the top of your head. Also, when you go swimming, wearing ultraviolet rash vests and protective clothing is always recommended. So when you come and see us in the clinic with pigment-related problems, the first thing we will do is a skin analysis. We have a lovely machine called a Visier, which takes photographs of your face from the front, the left and the right, and does a skin analysis. And it looks for pigmentation, redness, ultraviolet damage, so we can get an idea of exactly what an individual problem is. We can then work out a tailored treatment regime, whether that be products or peels or lasers or whatever. We can organize a regime to suit the individual patient, and we can monitor it by regular Visier analyses as the treatment progresses. So we and the patient can see exactly how things are improving. There are so many things that can be done. We have different types of peels, we have different types of products, ranging from VI derm peels to Dermamalan masks. You name it, we've got it. We even have an intimate bleaching pack for hyperpigmentation in more intimate areas. So whatever the problem is, however difficult it may seem, something can always be done, and we can always do that something. Come and see us.